Welcome to the Medical Center Show. Joe Scott, President and CEO. Today we have a really great program. We're going to talk about our neonatal intensive care unit. We'll be right back with our medical director, Dr. Alsheikh.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state. #1 for high-risk pregnancy. #1 for neurological disorders. #1 for stroke. Magnet Award for nursing excellence. A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center.
Welcome, Dr. Alsheikh. We're glad you're here. Tell us a little bit about, you've been at the medical center for a long, long time. How many years?
34 years, to be exact.
34 years, wow. So you've been taking care of these little tiny babies for 34 years.
34 years, yeah.
So tell us a little bit about your education and training. Where did you go to school? What's...
I graduated from Baghdad Medical College.
Okay.
And I did my residency in pediatrics back home as well, in pediatrics. And I came to the United States in 1978, did my qualification exam, went into residency program at the Jersey City Medical Center.
Oh, you did? You did your residency at JCMC?
Finished, exactly.
Wow.
And then after that, my love for the babies went into the Neonatal Fellowship Program. That was also at Jersey City Medical Center.
Okay.
I graduated in 1983, and since then I've been a full-time attending since then.
So you've kind of seen the transition of the medical center from the old place, what's now the Beacon, up on the hill, to our brand new, beautiful, state-of-the-art medical center that we have now. So what was it like back in the old days?
It was a very crowded unit. I call it like a can of sardine, where babies are really next to each other.
Wow.
And we had to really open nurseries all over the place. And at that time, our delivery rate and admission rate to the critical area was a lot.
Wow.
So we were really very squashed by the place. We're very, very crowded. And that's not good. It doesn't really comply with state standards, which we have right now, basically. Now we
have a beautiful state-of-the-art NICU, right? It's just fabulous. We've got the best equipment and everything.
Excellent. Everything is excellent there.
So why do babies end up in the neonatal intensive care unit?
Babies that are born premature, they have their own particular problem. There are full-term babies or near-term babies also. They are born, they have particular problem.
Right.
The major clients that we serve in our intensive care nursery are the premature babies.
Right.
For whatever reasons, they are born prematurely. They have major issues with their breathing. They have nutritional issues. There's infection issues, varieties of metabolic problems they have, as well as the near-term babies, which we call them preterm babies as well.
So even a baby that goes full-term could potentially end up in the neonatal intensive care unit?
Definitely, yeah. There are varieties of issues that makes a full-term baby sick at birth, whether it's infection-related, respiratory-related, other metabolic issues. So we do see a number of full-term babies that are sick enough to be in our unit.
Okay. So the NICU, does every hospital have a NICU?
Not really, no.
Not really.
They might have different levels. They might be level 1 nursery,
Okay.
which is just dealing with healthy, normal babies.
Right.
There'll be intermediate nursery where they deal with babies that have, not really very small. They don't need respiratory support in any way.
Right.
And they just might need antibiotic, might need IV, some feeding tubes if that's the case.
Right.
But NICU is where you have babies that are very small, very sick.
So we're a level 3 NICU.
We're a level 3, yeah.
That means we take care of the sickest babies.
Sickest base in Hudson County.
Yeah. I've been up there sometimes, and these babies are so tiny. I mean, how many weeks are they surviving now, earlier and earlier?
They
or?
could survive as low as 22 weekers.
22 weeks?
Yeah,
Wow.
we had one time 21 weeker that survived.
Wow.
But, we do make a lot of discrimination and a lot of counseling with parents when we're dealing with babies that are on the verge of viability, because the quality of life is not that great when you salvage such very small babies.
Right.
So the final word will be for the parents to decide whether to go with resuscitation,
Right.
do a little resuscitation, see what the outcome, or not to do anything.
Right.
So this is when the area between 21, 22, and 23, because this is, they call it the gray zone area,
Right.
where the counseling has to be performed, luckily and hopefully,
Sure.
before the mother delivers that baby.
Right. So at 24 weeks gestation, which is what, about 6 months,
Yeah.
you pretty much feel confident that those babies will do pretty well.
Yeah, there's good survival rate.
Right.
We're not talking about the quality of life, because that's
Right.
a different issue depending
Right.
on the course of and what the baby has gone through during the hospital stay.
Right. Now, what's the biggest challenge with a tiny baby like that?
Biggest challenge is really to maintain their respiratory status.
Right.
Metabolically, how we stabilize all the electrolytes and the metabolic issues with them. Basically, not a lot to deal with. And, we're just hoping that they don't get stricken with a bad outcome regarding their neurological outcome, regarding bleeding,
Right.
or what you call periventricular leukomalacia, where there's really infarction and
Right.
degeneration in the area and the white matter of the brain.
Sure.
These are the challenges. And of course, challenges doesn't end by the time you discharge them.
Right.
These babies really require a lot of follow-up in high-risk clinic to see if these babies are growing and developing in the right path. Because
So after they discharge from the NICU, they pretty much really have a lot to have a lot of follow-up.
a lot,
right?
yeah.
Right.
I mean, they need to be seen definitely for the eye clinic
Right.
to follow if they have any changes. We call retinopathy prematurity, which is a big problem.
Right.
If it strikes those tiny babies, especially the ones that are less than 32 weeker.
Sure.
And they have to be seen by the high-risk clinic.
Right.
And they follow in our rehab program regarding PT, OT, and speech therapy.
Mm-hmm.
And we're just hoping that they do well,
Right.
they do well. Because, progress has come so many strides, in respiratory management and dealing with the baby before the baby is born, where the steroids come apart to really induce the lung maturity while the mommy still have the baby.
So that's a good point. So sometimes moms will actually get a steroid shot if there's concern that they might deliver the baby early.
course, yeah.
Why do they do that?
Steroids, the betamethasone is known in 2 shots, actually. They give it like 24 hours apart, 12 milligram IM. It induces the stress to induce the lung maturity. And that has been a great point in the prenatal management.
So this helps the baby's lungs form
mature,
by
yeah.
giving the mom this steroid
Steroids,
shot.
yes.
Wow, that's
Yes,
amazing.
yeah.
How did they ever figure that out?
Well, it was probably done, and they found service. But now, actually, it's a legal issue if the obstetrician don't offer
Really?
the steroid injection to the mommies before delivery. Yes.
Wow.
It's an important thing.
And really, respiratory is one of the major issues that you deal with these tiny babies,
It's the
right?
number one. It's the number one. Yes, issues.
Yeah.
I mean, if their lungs are relatively mature, I mean, it's not just the lung being mature it's not mature and sick. Basically, the drive of breathing is not there on those babies because the breathing center, which is in the brainstem, is not that mature. And that's one thing you have to deal. So we give them some medicine. Basically, it's caffeine. We drink coffee
to try to
release
stimulate them
It
to breathe.
stimulates and works wonders, in those babies. Hardly you really need anything extra.
So it's the brain that's controlling their breathing, and because the brain isn't fully developed, they have trouble controlling their breathing,
Yes.
and you have to give them caffeine or
Yes,
something like that to
yes.
kind of stimulate them to do.
Yeah.
Wow, that's kind of fascinating. You've probably learned so much over the past 30 years. I mean, it's just amazing. And the technology has had to change over those 30 years.
We have all the technology to support the babies that have breathing problem.
Wow.
We have oscillators, varieties of machine, CPAP, CPAP machines that delivers, positive pressure ventilation through the nose as well. And we've come across.
We'll be right back. We're going to talk more about how you take care of these babies in our NICU. Thanks.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Alsheikh, the director of our Neonatal Intensive Care Unit, talking about the tiniest babies at Jersey City Medical Center. So we were talking about steroids and how that helps kind of the baby's lungs develop, and that's a big problem. There's some new drugs too, right, that are given once the baby's born to help the lungs function more appropriately. Tell us a little bit about that.
The premature baby's lung, besides some anatomical and physiological maturity, they lack a special substance we call a surfactant, which is in every human being lung.
Right.
And it keeps the lung prevent the alveoli or the saccules from deflating at the end of exhalation. And it does help when the baby is really breathing and there is no surfactant, the alveoli could really over-distend and they can blow up. So we have a surfactant, which is artificially made, and then we give it to those babies that have shown significant immaturity of the lung. We call it respiratory distress syndrome. And it does help dramatically. I mean, for a baby who's really requiring huge amount of oxygen, once you give that substance, that medicine, intratracheally through a tube that is going into the windpipe, dramatically improve because they replenish that substance that's lacking in their lung.
Wow.
And right away, you can see their oxygen dropping down to 21% oxygen. Fantastic, just like the amount of oxygen we breathe.
That's really amazing.
So,
and before that, these babies would just struggle.
They were struggling, and because of the oxygen and the respirator dependency, they go, a lot of them, into a chronic lung disease. The lung is so sick that we have to use a lot of pressure, and they get used to get a lot of air leaks. And pneumothorax was a common thing. And when we started neonatology, it was disaster with the air leaks and with babies lingering on the respirator, and their lung get pounded with the pressure and the oxygen, which is oxidant. A lot of damage used to happen to their lung. Now, thanks to the OB management with the steroid, thanks to the surfactant we give, those babies, even the tiny babies, you can amazingly see them breathing by themselves, requiring minimal non-invasive support through a nasal CPAP, or just, they have nasal cannula in the nose. Extreme improvement in the respiratory management of those tiny babies.
Now, in our neonatal intensive care unit, first of all, we have doctors in that unit 24/7, right?
Correct.
I mean, they're there all the time.
Correct.
So not only are the nurses there, but the doctors are there taking care of these little tiny babies, because they have to be, right? Because they're the sickest, tiniest babies. And then we have nurses who are specially trained in neonatal intensive care. I know that we've recently bought some new equipment that kind of helps the babies too. Tell us a little about this it's called a giraffe, right?
It's a giraffe omnibed. It's a state-of-the-art, well-equipped incubator that turns into a radiant warmer.
Wow.
And it has a built-in ability to humidify the air around the baby. It keeps the baby from being cool, so a special system where it really flows air into it. It has a very tiltable mattress, soft mattress that goes 360 degrees. It's a wonderful device, and we thank administration for really getting us those giraffe, because basically dealing with the tiny babies where the insensible water loss and the minimal management, the minimum manipulation that we do them a lot of good thing, and the adjustment that it goes up and down. And we can weigh the baby on those incubators.
You don't even have to take
Before
them out.
We have to pull them with all the catheters and the equipment that they have, and we put them on a scale, and they get chilled, and they're just disturbing baby. Now we can weigh them inside the incubator. So it's a wonderful piece of, we call it the Cadillac of modern.
The Cadillac of modern NICU.
NICU,
You're treating NICU babies. the other thing I notice is the lights are down low and it's dark in the NICU, and we've got covers we got blankets over the top of the isolette. Is that because, I mean, why do we do that?
It's, babies these babies, when we manage them in the unit, they were supposed to be in the uterus. And in the uterus, there's darkness. Wow. There is uterine sulfur, smooth noises that they get. So we try to developmentally imitate what the baby's environment in utero.
Right.
So you're giving them more darkness, giving them more peace, less stimulating them by noises, by light, does good for them developmentally, okay. And of course, so you cut the light on them, you try not to manipulate them. It's
really quiet in the NICU.
It's
when
very
you walk
quiet.
in
It
there,
should be
right?
as quiet as possible. When they grow older, yes, they need the exposure to the light. They go through the circadian rhythm that they have to know that there is light there. And, the interaction with the nurses when they feed them, that they touch them, when they do any procedures. Right. It's kind of beneficial because they get all these sensory stimulation at the particular gestational age as they grow older.
So, and in the NICU, you once told this to me, and it's kind of always sticks in my mind. So we have a baby who comes and is delivered at 24 weeks. You would always say to me, well, you know what? I would always say, when's that baby going to be discharged? And you said, pretty much they follow the same path as if they were being delivered normally, right? I mean, the same amount of time? Is that what we kind of tell the moms?
Much earlier.
Much earlier.
Much earlier. They go home probably around 34, 35 weeks.
Oh, they do. Great.
Weeks was the stationary age. So they definitely go. I mean, there is a concept in the community that, the baby going to go home in 5 weeks and 5 pounds.
Right.
I said, no, the majority go around 4 pounds, and that's the reality. Okay?
Right.
Now, with really advancement in nutritional support, and we are very proactive into nutrition, we are very proactive in using breast milk for feeding those premature babies for a lot and host of benefit that these babies will get for the mommy and the baby as well. We're getting those babies much earlier home.
Right.
Yeah.
So anybody who's high risk, who has a high-risk pregnancy, I mean, they really want to deliver at a hospital like ours that has this NICU that can take care of a baby that might be delivered prematurely, right? I mean, we really do want to stress that for moms in the community. If you are having any kind of problem or you've had problems in the past, you want to deliver at a hospital that has the highest level neonatal intensive care unit.
Absolutely.
And you want to see a specialist before an antenatal, like at our antenatal testing unit, right? Those are doctors that are perinatologists that specialize in moms who are having problems. So,
of course.
Yeah.
It's very important. Whenever the mommy is identified to have certain high-risk factors for delivering a premature baby, that mommy has to be followed by a perinatologist, which is a doctor who specializes in high-risk pregnancy.
Right.
Whatever the case could be. And you know what? A safe thing to say that an obstetrician or a midwife that deal with such pregnant women, they should refer them voluntarily to the perinatologist, where you can secure that the mommy's health and the baby's health is in good condition, and hoping that the mother would deliver close to term baby, and we will have a healthy baby as well.
Right. Yeah, because, sometimes moms don't get that, and that causes all kinds of problems, right? Because isn't there a whole bunch of preventative things that these perinatologists will help the mom keep the baby for as long as possible?
Of course.
Yeah, so I think that's important. I mean, the longer the baby stays in utero, the better off the baby is, right? That's the best environment for them.
What I say to the mommy every day, I mean, we get involved with the prenatal consult to give them options, and we give them outcomes of their babies, so they are kept abreast of what happened if the baby is delivered at this particular gestational age. And I would tell them all the time, every day your baby's staying inside you in good health. Is better than coming outside.
Right.
Every day is an added maturity.
Right. Yes. That's great. We'll be right back to talk more about our NICU babies.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back. We're here talking about our neonatal intensive care unit at Jersey City Medical Center. So Dr. Alsheikh, couple things. We're a baby-friendly hospital. Everybody would think baby-friendly. All hospitals are baby-friendly. Tell us a little bit about that initiative and what we're trying to accomplish.
Baby-friendly initiative that we are working at, and we're almost, finalizing. The final step is working toward, increasing the bonding of the mommy with the baby.
Right.
And that comes through really what you call kangaroo management, which is skin to skin, enforcing breastfeeding. Now, breastfeeding across the border is beneficial for premature babies as well as full-time babies.
Right.
And it's healthier. It prevents a lot of diseases on the baby, especially a very serious infection. We call it necrotizing enterocolitis, which is a serious infection in the bowel of the baby where it can end up with gangrene, with perforation. And a significant number of these babies really die because of that serious infection.
Right.
So the mommy's participation in providing breast milk by pumping for those premature babies or the babies that we have in the unit has been a tremendously great and helpful step. And, we try to restrict the use of formula. And that's where we are going right now.
Right.
We encourage the interaction of the mommies. And, nursing staff, physician staff, we are so much into the family-centered approach to the whole management. I mean, don't forget, this is their baby. And we want to make them feel that they are at home.
Right.
And after a while, from the initial stage of fear, feeling of loneliness, feeling of guilt, and whatever they go through as a normal pattern after they give birth to sick premature babies, you get to know them, they get to know you, you become friends, and they get used to the surrounding.
Right.
And when they come, they are welcome to this unit. Mm-hmm. So that's all the whole thing. It's just promoting good bonding.
So a mom who delivers a premature baby, a really tiny baby, they can't breastfeed, right? I mean, they have to pump their breast, and then they bring the baby's milk down to the NICU, and that's how that works.
Yeah, from the beginning, if the idea about pumping milk hasn't come to their mind, or they haven't been approached through prenatal, some physician might not be that much into breastfeeding, and it might come just the first time. Then when they give birth to the baby, or when we talk to them in prenatal consult, we bring the issue of pumping the breast for the premature baby if he or she is born prematurely. And I would say, amazingly, the number of mothers that are participating in pumping, and they pump for weeks and months because it's not natural feeding. And a lot of mothers, if they're taking it loosely, they're not pumping day and night, they're not taking good hydration, they're not resting their body, they're not watching pictures of their babies to stimulate that hormonal letdown, they could really dry in no time. But we have extraordinary great mothers. They go and even when the baby's ready, maturation, to really try to do the bottle, they could go and latch on the mommy, and then we continue with breastfeeding just like it's a full-time baby.
Wow.
So I'm amazed with the number of mothers.
And that really, really helps the baby so much more, right?
Breast milk is natural milk.
Right.
And as I say, every species have their own mothers to feed their own offspring, right? And we say we don't want a cow feeding our babies.
Right.
We want a mommy to feed. And there is that colonization with healthy bacteria that comes from the breast milk, the easy digestibility, the prevention of that disease that I called necrotizing enterocolitis, the immunological factors that come through the breast milk is not available with the formula that we give. And then there's definitely literature that say about the value of intellectual and high IQs on babies that are breastfed.
Wow, there's even a correlation between breastfed babies and the IQ? Wow, that's amazing.
I joked to the mommy. I said, Mommy, if you want your baby to go to medical school like me, breastfeed your baby. And they start laughing. Yeah,
that's good.
But that's the fact. Babies that are breastfed have higher IQ compared to babies that are on cow milk.
Wow, so it sounds like there's a million reasons to make sure that babies are breastfed. And so we're going to get a designation as a baby-friendly hospital. That's our ultimate objective.
That's a goal,
the other thing you talked about